Welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Thank you so much for joining us today. Our guest is Dr. Denis Cortese. He's Foundation Professor and Director of the Healthcare Delivery and Policy Program at Arizona State University. He's also co-author of the book, Rescuing Healthcare, a leadership prescription to make healthcare what we all want it to be. He's here to talk about the book and why he wrote it as co-author with Antony Bell, what they hope to accomplish with the writing of this book, and about leadership in healthcare overall as best we can in the short period of time that we've got. Welcome to the program, Dr. Cortese.
Thank you very much, Neal. It's a pleasure to be with you, and I'm happy to talk to you about this.
Thanks so much. Now, you're a former CEO at the Mayo Clinic, a rich bit of experience in the healthcare industry on several levels. You co-authored the book, Rescuing Healthcare, with Antony Bell, a leadership prescription to make healthcare what we all want it to be. And what is it that you think we all want healthcare to be?
That is the fundamental question, Neal. I think that everyone has to address for themselves. It's the key to what our future is going to look like, especially this century. Whereas you, with your experience in healthcare, there's so many things we're going to be able to do that's so different than in the past. So, what could it be like? And I've asked this question to people ever since I started to focus on what healthcare could look like in this country. I've asked a couple of questions to people at every meeting and every speech and talk I've ever given. And it goes like this. First of all, if we're going to design a new healthcare system, just think of this for yourself or your viewers, your listeners. Number one, who would like to be admitted to a hospital tomorrow? Is there anyone out there who really wants to go into a hospital, tomorrow, even if it's the best hospital?
Think of anybody.
So most people will say, and just about 100% of people said, no, they don't want to go to a hospital. I'd like to avoid that. So if that is one of the goals that we're looking for, trying to avoid being admitted to a hospital, we need a healthcare system in which the hospitals are not viewed as the center of the universe. They're just we're all going to need hospitals perhaps sometime, maybe just once in your life rather than 10 times, for instance, and maybe some people can avoid completely. So that becomes one of the goals. Second question I've asked is, who would like to actually want to see a physician tomorrow for some problem that they may have or not have, try to avoid the problems? Most people say they prefer not to have to see a physician tomorrow. And then my third question is who would like to be what is called a patient? Patient is somebody, by definition, somebody who long suffers and long endures. And there are very few people that actually want to sign up for that. They don't want to even be that. So if we say to ourselves, what can the future look like in this century? It would be providing health care by keeping people healthier. If you have a chronic condition, let's say diabetes, how do we keep you as healthy and functioning? If we can cure it, great. If we can't cure it, how do we keep you being as well as possible and as healthy as possible, doing exactly what you want? And if we can't accomplish that, how do we actually help you be as comfortable as possible as we move in the future? We have all these tools to be able to do this now. It's just that our current delivery system is oriented predominantly in a model where when people are sick and they go to a hospital or they go to the doctor, we're paid for that as physicians. It has to be a totally different model to be able to have money to stay in business while we're keeping you out of the hospital, keeping you out of doctors' offices and functioning well. So that's quite a change, don't you think?
Yes, I do think it's quite a change. But even the points that you mentioned about, how can we keep you as comfortable as possible? How can we keep you as well as possible as physicians advising you on your health? Okay, so you get paid. Does that mean that you're taking advantage of the fact that you're going to get paid anyway for such good care?
Yeah, well, it does. If you are working to care for people in such a way that these people are actually doing better. Now, the majority of folks probably won't ever have to even see a doctor. I mean, any given year, only about 20% of people actually ever get into a doctor's office, or they're sick, or actually go into a hospital. The question is, how can they do even a better job for each of us who right now I'm going through a problem with my knee, I'd certainly be really happy to have a physician who's helping take care of my knee so I don't have to have a total knee operation or some kind of arthroscopy. So to do that, however, requires significant leadership at many, many levels, but particularly at the leadership level of the organizations that are providing the health care. They have to have a change in mindset. That mindset will trickle into new payment models, new care models where we take care of you by phone, telemedicine, emails, and visits to the house if necessary to keep you functioning from day to day. Children with asthma, rather than lose 30 to 40 days of school a year, which is what happens to the sickest asthma patients, particularly those on Medicaid. How do we keep them in school with different models of care, monitoring at a distance, using their cell phones, sending text messages, working with nurses in the schools? The fact is, if we try to do any of those particular things, we're not paid for any of that. There's no way to get paid. So changing the business model, it takes leadership, and physicians are doing this now. We're seeing it around the country where they have developed new models of care so that patients who sign up for their care are actually basically in a new kind of an insurance model, basically a capitated type model where the money is provided up front. So the better job the physicians do, and the nurses and the home practitioners and the telemedicine people, the better job they do, the more money that they can actually retain to stay in business.
So if I'm understanding correctly, it's rapidly coming to the point where, based on what the patients or your group of patients say about you, about your care, there's going to be, I guess, a scale that says you get paid this amount as opposed to the amount that the doctor doing the same amount of work with the same amount of patients gets paid, based on the mindset of the patient. Now, we as patients, we're going to try to pay you regardless of the price. We already assume that you have the leadership skills to be ethical with, the payment structures. Now, as you say, the face of the structures is changing. But as the co-author of this book, Rescuing Healthcare, aren't our leaders in healthcare ethical now? I thought it was just all about the pharmaceutical industry and the insurance companies that was making the money so hinky, for lack of a better term. Is it the physicians themselves?
No, it's not so much the matter of the ethics. It's a matter of the current business model is predominantly driven by a fee-for-service model. So we can be extremely ethical physicians, and we take care of you when you're sick. But it doesn't necessarily mean that the physician can engage and keep you out of the hospital in a longer term in a fee-for-service model, because nobody will pay for the kind of care that would keep you out of the hospital. We get paid when you're sick and in the hospital. I'm talking about leadership at the physician level and changing the whole ethos of their business models away from fee-for-service. Let me give you one example.
Right.
By the way, Medicare Advantage plans do exactly what I'm talking about. Not regular Medicare, but Medicare Advantage plans, which a patient signs up for it. There's a certain amount per month that they pay, and Medicare from the federal government also contributes money to this Medicare Advantage plan. And the Advantage plan, at the beginning of the year, they know how much money they're going to make, period. It's done. It's a capitated amount. The patients don't have to pay fee-for-service as they go forward. But within this new model of care, within the new model of payment, the physicians and the insurance companies working together design new models of care. For instance, in Presbyterian the hospital system in Albuquerque, New Mexico, they have a model with their Medicare Advantage plan where they offer hospital care in your home. So if a person's sick, they bring the equipment and the nurse goes to the home. The doctor makes rounds a couple of times a day. They provide it for certain conditions to keep people healthier and out of the hospital, because really they're safer out of the hospital. It reduces the cost. Patients are much happier. The risks are reduced. So it's a new model of care that if the patient was not in the Medicare Advantage plan and they were in regular Medicare, Medicare will not pay for hospital care at home. So it's a key leadership change in the mindset of focusing on the needs of patients and creating new care models. But to do that, they have to have some business sense on how to get a new payment model to match it. And that's one of the key changes that we're facing, I think, this year in the country. And there are over 100 large provider organizations that do exactly what I'm talking about, because they have their own Medicare Advantage plans, Medicaid Advantage plans, or they have commercial plans where they are at risk financially, and they create new models of care. So that's what we mean by leadership, is that the leadership, part of the roles of leadership, as you know from our book, is to really think about the vision for the future, sell the vision, align the organization to be able to get where they need to go. But to do that, if the vision is to keep you out of the hospital and keep you really healthy as much as we can, we have to break away from our current business model, which is fee-for-service, and move out of that canoe of fee-for-service and make a step into another canoe, which is a totally different business model. And the business model then leads to fewer hospital admissions, fewer ER visits, maybe fewer procedures that are done to people, all of which are good. But it takes a courageous and visionary leader with a team that can orient themselves around this new model. That's why I really approached Tony to help to write a book, and our book is focused on issues and concepts and constructs for leadership. We only have one chapter about what a new future could look like. That's what you and I are talking about.
Yes.
The rest of the book is the construct that is needed to create good leadership. So I'm really trying to change the business models and the way health is provided for individuals, because we can do it today. But when you're living in an environment where we know that we can provide good advice and care for patients using telemedicine, but yet Medicare and private insurances will not pay for that, you can't get there from here. You got to break out of that old system and create a new one.
Absolutely. Now, where can we get a copy of Rescuing Healthcare, a leadership prescription to make healthcare what we all want it to be?
Well, I think Tony mentioned it in his interview with you also, but it's available on the web, e-books. It's available on Amazon. If you just type in either Tony Bell's name or my name or leadership in healthcare, it will also come up in the search engine. So they can get the book on the web.
Thank you so much for joining us today. Dr. Denis Cortese.
Thank you very much. Nice talking.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be sure to visit our affiliates page when you visit our platform at hpr.fm and healthprofessionalradio.com.au.